Hey gang, this is Dr. Jeff from the Midwest Disc Institute and Legacy Chiropractic in Shipshewana, Indiana. Today, we're going to talk about water, we're going to talk about a backpack, we're going to talk about your spinal disc. See, it's been shown that when you have a disc herniation or disc damage, the disc has lost half of its sulfate content. It's lost half of its sulfate content. Well, what is sulfate? First, we need to understand that your disc is made of 86% water, right? So the more water you can drink, the better. But the disc needs to get that water inside itself, and there's one way it does it, through what's called sulfate. So think of this, okay? Let's look at this. We've got a canister of water here, a gallon of water, and this water needs to get into the disc. There's only one way it can happen, through what we call a sulfate carrier. A sulfate carrier is like this backpack. So what happens is I take this water, I put it in the backpack, and now I can carry the water somewhere. Well, the sulfate acts like the backpack that attaches to water, and when you bend and twist and turn and move, it brings the water into the disc. So sulfates are what carry water into the disc, like that backpack carrying the water. The sulfate carries the water into the disc, and it happens through a pumping mechanism. And what the sulfate does is it helps repair and rebuild the disc. Now, the best way to get that sulfate is through glucosamine sulfate and chondroitin sulfate, but the chondroitin, the best version of that, is what's called green-lipped mussels. So we have a product, if you're sitting in our reception area watching this, we have a product you're going to ask our front desk about, ArthroSoothe. ArthroSoothe has both glucosamine sulfate and chondroitin sulfate, plus some other fantastic herbs and things for inflammation and helping things pass through muscles and things like that. So we have glucosamine sulfate and chondroitin sulfate plus some other great factors in ArthroSoothe, and the sulfates are what will attach to that water and bring it into the disc. Word of caution, if you have a shellfish allergy, clams, mussels, shrimp, you will not take the chondroitin sulfate, you will not take the ArthroSoothe, because the chondroitin sulfate is from green-lipped mussels, which again has been shown to be the highest amount and the best version of chondroitin sulfate. If you have no shellfish allergy, walk up front, ask our desk all about ArthroSoothe, and grab yourself a bottle of ArthroSoothe, because it will attach to water like the backpack and bring that water into the disc. Have a great day.